Meet MAKO, a robotic arm-assisted technology used by surgeons to perform total knee replacements. This unique technology helps surgeons provide a personalized surgical experience, where each surgical plan is based on a patient-specific diagnosis and anatomy. And in a laboratory study, MAKO Total Knee enabled surgeons to execute their plans more accurately, while also protecting soft tissue and ligaments from damage. The surgeon guides the robotic arm to remove the arthritic bone and cartilage from the knee. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, these cues help the surgeon stay on the preoperative surgical plan. With the diseased bone gone, a knee implant is inserted into the joint space. And once the surgeon is comfortable with the knee's movement, it's off to the recovery room to begin the journey towards strengthening the knee joint.